Vitamin E may offer significant benefits in improving insulin sensitivity, particularly for individuals dealing with metabolic syndrome or type 2 diabetes, conditions rooted in chronic inflammation and oxidative stress. These two factors not only drive insulin resistance, but also contribute to the progression of complications such as cardiovascular disease, fatty liver, and neuropathy. Vitamin E, with its potent antioxidant and anti-inflammatory properties, acts at the cellular level to counter these harmful processes, helping restore more balanced glucose metabolism and improving the body's responsiveness to insulin. One of the central issues in insulin resistance is the damage caused by reactive oxygen species, ROS. In people with metabolic syndrome or type 2 diabetes, elevated blood sugar levels and excess fatty acids promote the overproduction of ROS within muscle, liver, and fat cells. These reactive molecules impair the signaling pathways that insulin uses to help glucose enter cells, leading to a vicious cycle of higher blood sugar, greater oxidative stress, and worsening insulin resistance. Vitamin E helps break this cycle by directly neutralizing ROS, especially in cell membranes where insulin receptors are located. By preserving membrane integrity and restoring cellular responsiveness, vitamin E helps insulin perform its job more effectively. Clinical studies have begun to support this mechanism with measurable outcomes. In some trials, vitamin E supplementation has been associated with reductions in fasting blood glucose, improvements in HbA1c levels, a long-term marker of blood sugar control, and better insulin sensitivity indices. One of the most studied forms is alpha-tocopherol, which can accumulate in tissues prone to oxidative damage, like fat, muscle, and the liver, where it helps regulate inflammation and glucose transport. Additionally, vitamin E may enhance the function of pancreatic beta cells, which are responsible for producing insulin. Protecting these cells from oxidative damage can support more consistent insulin production over time. In the context of metabolic syndrome, where abdominal obesity, high triglycerides, low HDL cholesterol, and high blood pressure cluster together, vitamin E's benefits are even more comprehensive. Beyond improving insulin sensitivity, it may help lower inflammatory markers like C-reactive protein, CRP, and tumor necrosis factor alpha, TNFA, both of which interfere with insulin action. Vitamin E's role in reducing lipid peroxidation also contributes to healthier fat metabolism, making it easier for the body to use fat as fuel rather than storing it, especially in the liver and around organs. It's also worth noting that people with metabolic dysfunction often have lower levels of antioxidants, including vitamin E, due to higher rates of oxidative turnover. In these individuals, supplementation can help replenish depleted stores and bring antioxidant status back into balance. However, the form and dosage of vitamin E matter. Natural vitamin E, D-alpha-tocopherol, is better absorbed and retained in the body compared to synthetic versions, and mixed tocopherols or tocotrienols may provide broader metabolic benefits. In studies where higher doses of vitamin E, typically 400 to 800 IU per day, were used under supervision, improvements in insulin sensitivity were most noticeable when combined with lifestyle changes like diet and exercise. While vitamin E is not a replacement for glucose-lowering medications or dietary management, it holds meaningful promise as a complementary approach. Used thoughtfully, it may enhance the effects of other treatments, reduce the burden of oxidative stress, and support long-term metabolic health. People with type 2 diabetes or metabolic syndrome should work with a healthcare provider to determine whether vitamin E supplementation is appropriate for their individual needs, especially if they are already taking blood thinners or other medications. In conclusion, vitamin E may help improve insulin sensitivity by calming oxidative stress, supporting insulin receptor function, and protecting pancreatic beta cells. For individuals navigating the challenges of metabolic syndrome or type 2 diabetes, it offers an added layer of cellular protection and regulation that supports better glucose control and overall metabolic resilience. As part of a comprehensive, integrative approach, vitamin E can be a powerful ally in restoring balance to the body's most essential systems.